Good afternoon, everyone. It's thrilled to be with you all today to share some information about our program and how we can be of assistance to those that you all serve. Um, the title is Connecting the Dots to Access Resources, and I'll explain how we do that um, in the course of this session. So first of all, what is Tennessee Disability Pathfinder? We are a program of the Vanderbilt Kennedy Center and Tennessee Council on Developmental Disability that includes a statewide multilingual clearinghouse of disability resources, includes a phone helpline, a website of disability information and resources, multicultural outreach program, and community training program. But first of all, I want to start as to why it's important for you all to know that you can use us as a resource. Well, first of all, services in Tennessee are very fragmented, as you are probably very aware in trying to assist patients. There are not a lot of government programs to meet all the needs of individuals in our state. So a lot of nonprofit organizations apply for grants and develop programs to help fill those gaps and to provide supplemental services to individuals, especially those with disabilities. So it can become very difficult to know who to contact for what type of service and how to access that services. It's also a difficult system to navigate. It's very complicated programs, Social Security, TennCare, Medicare, all these big government programs are not easily accessible. So that's where Pathfinders staff can help individuals, whether they're agencies or families, help navigate that system. And I'll give you an example, which you all are probably very familiar with, but for families that aren't aware of the systems, it's confusing. The new health insurance, TennCare in particular, is no longer accepting applications to the Department of Human Services. You now have to apply through the marketplace. And so for individuals who don't know that process, it's difficult to access. And so we can point them in the right direction as to how they go about doing that. They have the option of going online, and then they can also go to a kiosk at the Department of Human Services offices. So that's an example of a system that can often be difficult. We spend a lot of time networking and collaborating so that we are aware of the information that we provide, identifying new resources, new services that are available, and how we can partner with organizations to create access to those systems and services. We keep our resources updated annually on an ongoing basis, so we know that the information that we provide is current and accurate. And essentially, we are a single place to call for all types of disability information and services. And the way in which we connect the dots, you'll see 4 joined circles. Tennessee Disability Pathfinder being joined by the 3 other ones. On the left are individuals with disabilities. That's essentially who we serve. On the right are state government programs and nonprofit agencies. Those are the resources in which we connect individuals with. And the way in which we connect those are based on eligibility criteria, both what the person qualifies for and what the resource asks that they have in terms of eligibility. So we determine the person's age, the type of disability, the income level. We don't get into real specifics, but are they receiving any type of government assistance, like Social Security, the county in which they live, and the service that they're seeking. And based on that information, we match up what resources will meet that person's need. You'll notice that we're limited in terms of government programs, nonprofit agencies. We don't get into very many private providers, such as doctors or dentist or things like that, because that's overwhelming and difficult um, to maintain. But if someone calls us with a specific type of disability, let's say, for example, Down syndrome, and they're looking for a doctor that has some type of knowledge or specialty in serving that type of disability, then we will do the research to find out what private providers are available for that specific need. And oftentimes that involves referring them to an area association like the Down Syndrome Association, who has that family network and knows what doctors may be able to best assist that individual without us knowing specifically who they are. So although we don't have those types of resources in our database, we will try to find that information in other means. So, and I like to say that resources are a phone call away by contacting us, but there's also a big if at the end of that, because that's if the service is available. We obviously can't create miracles and meet the needs of every person that contacts us, but we will sure do our best to know what is available and how they can seek that service and assistance that they're needing. So, and the way in which we do that is through our phone helpline primarily. We have a very diverse, qualified staff. We all have kind of different backgrounds in terms of personal experience and education, which includes special education, psychology, social work, personal experience as family members, things of that nature. So we really try to pool our knowledge and provide the best service that we can based on our various backgrounds. And we really provide help in finding useful disability resources. And I emphasize the word useful because oftentimes we are not the first point of contact for individuals and their families. And so we want to eliminate any type of frustration or confusion that they may have already experienced in trying to access a service. So we're going to really try to pinpoint what will best meet their needs based on what they qualify for and what's available. For example, if someone contacts us and says that they're looking for behavioral services, we are not going to pull up every agency and provide them a long list of those that provide behavioral services. We're going to determine what's in their area, who accepts the insurance that they have, the age appropriate service, so on and so forth, just as I mentioned earlier, based on that eligibility criteria. And we serve individuals with disabilities of all ages, their families, and agencies that serve them. So pretty much anyone and everyone. And we use the word disability very loosely. There's not a prescribed definition that we have a standard of using. So if anyone calls us, we're going to do our best to meet their needs, no matter what their diagnosis may be. We may have more resources available for more specific disabilities compared to health conditions, but at the same time, we will again do our best to connect them to the information that's available. We are multilingual. Our staff includes individuals who speak English and Spanish, and then we have access to interpreter services for all other languages. This is our contact information. It's also available on the materials that were provided to you in your bags. There's a flyer and a bookmark. So people can contact us through our statewide number as well as our email address. And I want to go over a little bit about how we serve multicultural populations as well, in case you encounter working with individuals from diverse backgrounds. This program really strives to alleviate barriers to accessing disability resources, and they do that through a variety of ways, collaborating with different organizations, providing trainings, um, advocating on behalf of individuals seeking those services. And they also create cultural awareness, education for different um, providers interested in learning how to better serve diverse populations, so on and so forth. And again, they serve individuals all ages, all types of disabilities, and all nationalities. For those living in Nashville, we offer a parent support group for Spanish-speaking families that's held once a month at Vanderbilt, and it's for all types of disabilities. There's one, it's more educational, so every month there will be a guest speaker to present about a specific topic relevant to a child's need, and it's all spoken in Spanish. So if you work with any families, we'd be happy to connect them to that if they're interested. Again, there's the helpline. That's how people contact us primarily. Um, but instead of the services that we typically provide for English-speaking callers, where we provide them the information that we think will best meet their needs, and we leave it up to them, try to empower them to access that service. And feel free to, and have them feel free to call us back if they have any questions. The multicultural team provides more of a case management approach. So they will take that one step further, follow up with the families periodically, even contact some of those agencies on behalf of the families to make sure that the service is accessible, that sort of thing. The staff includes 2 immigrants and 1 refugee, and we distinguish this because those are very different experiences that these individuals face when coming to the country. Obviously, refugees have a period of time where they're entitled to some services until they can get settled, whereas immigrants come on their own and are really independent from the moment that they arrive, which makes it a little bit more difficult, perhaps, to navigate and to access those services. We also have a staff member, one of the staff members, I should say, is a liaison for the Department of Intellectual and Developmental Disabilities. So anyone interested in applying for the Medicaid waiver waiting list or family support funding can access our office, especially those who are limited, who have limited English proficiency. And she will assist them with that process in applying. So keep that in mind as well. So besides contacting us directly through our helpline and email, you can find a wealth of information on our website. So if you all have a laptop or iPad or some type of device that you with you today, I encourage you to pull it out and we can explore the website together. If not, that's okay. I'll give you plenty of details for you to go back and explore on your own. So the first case scenario I'm going to read to you is Cecilia went to her 9-month well child appointment. Her mom thought it was going to be a pretty typical appointment. The doctor asked a lot of interesting questions about how Cecilia was scooting around the house. He finally said that he was a bit concerned that she wasn't crawling yet, and that most babies crawl before they're 7 months old. The mother was unaware of the age Cecilia should be crawling. The doctor told her not to be alarmed, but encouraged her to meet with someone who could help her daughter. Since she had been coming to the doctor's office since her 5-year-old son was born, she trusted him and agreed to meet with the other staff person. Without having to drive to another building, she met with the other staff members who said she was going to help coordinate the care her child needed. So this may be something that you all experience in your work environment. So we're going to look at some questions and how Pathfinder could play a role in assisting this family. So this is a copy of our webpage, which is accessed through www.familypathfinder.org. And so you'll see a dark green navigation bar at the top. And the first option to click on is Search Database. And for anyone that's using and following along, please stop me if I go too fast. So you click on that first option, Search Database. It'll take you to the next web page. And there's a question at the top that will help guide us. It says, what organizations specialize in working with children with developmental delays? Well, the first drop-down box provides you a list of search categories to choose from. And for anybody exploring, you can see all the different options. There's over 50 different categories. And in this case, I chose Early Intervention Program for young children. So you click on that option in the first drop-down box. And then the second one allows you to choose the county. So I'm assuming that this family is living in Davidson County. And that's why I chose the second box. You click the Submit button, and it'll take you to the next page of search results. And you'll see a whole list, and I apologize that this is small, but it gives you the name of a program or agency, the website, if they have one available, a phone number, and the actual location of that agency. And I tried to enlarge Tennessee Early Intervention System as an example. But if you want more information about any of one of these agencies listed, you could click View Details. And that'll take you to the next page, which provides additional information. It provides you a list of services that they offer. So there's some organizations that provide more than one type of service, like early intervention as well as therapy, physical therapy. So that would be listed in that case. It provides you a summary, so a brief description of the services that are provided. Eligibility guidelines, for example, the age at which they serve. In this case, it's birth to 3 years old. They also have to have a proof of residency. Interpreter availability. In this case, they have staff that speak Spanish, but they also provide interpreter services based on request. The hours at which they can best be contacted, whether or not their facility is wheelchair accessible. The fees, it's not going to provide you a dollar amount, but it'll tell you what forms of payment that they accept. In this case, there's no cost associated, so it's free. But in other cases, it may say Take Care, DIDD waiver, private insurance, private pay, sliding scale. So if there's a discounted rate for those who qualify. So that gives you a little bit ideas to how that family could access that service through those forms of payment. The types of disabilities that they serve, these are broad categories like autism, behavior concerns, blind, low vision, deaf, hard of hearing, health or disease, intellectual disability, so on and so forth. And then the counties that they serve. And then on the right, you'll see the light blue box that has the contact information, phone numbers, physical address, and website again. So this is provided for each of our agencies that's in our database. And we have over 2,200 agencies throughout the states that are included in our resources. So another question that may come up based on Cecilia's situation is that what organizations, specialists can test to determine the type and cause of such delays? Well, again, Tennessee Early Intervention Services will provide that assessment to those to those children. But let's say, for example, the family wanted to seek outside resource, maybe a second opinion or other type of professional um, testing. There is a category in our database that says developmental, educational, psychological testing. So again, you could choose that in the first drop-down box and um, it determine what resources are available for that need as well. And then another question is, the family has health insurance but has a deductible of $2,000. Are there organizations that can assist the family in paying the deductible? Unfortunately, the financial assistance resources in our state are very limited. We get a lot of calls that are similar to this type of questions. Um, and so it's possible that one of the suggestions that we would give would be the family support program. How many of you are familiar with that? A few of you? This is a state program that provides um, one-time, one-time annual contribution to a family to help cover some type of cost related to the person's disability. So it can't be spent on rent or utilities or things like that. It has to be something that's specific for the person who has the disability. So, for example, healthcare costs or respite care or um, some type of therapy or piece of equipment or home modification, things like that. So we would do a little bit of research and find out if the family support program might be an option for that type of financial assistance that this family needs. And if so, we would provide them that information for them to apply. So. And then after the initial assessment, it is determined that the child needs occupational therapy. How could you, as a care coordinator, assist the family in finding an occupational therapist and assist in paying for the services? Well, again, that's a service that qualifies under Tennessee Early Intervention Services. But again, if you want an outside source, you can also search for physical occupational therapy in our database, and a list of agencies that provide that type of service would appear, just as it did previously. So again, but the financial assistance piece, that's another example of family support funding that would qualify. Um, Perhaps look under the fees section for a sliding scale, or perhaps there's one that says free. So you kind of really do a little bit of research to determine what specific organizations would meet this family's needs. And the mother is having difficulty accepting and understanding her daughter's challenges. Are there organizations that can assist the mother in education and support? And the answer is yes. There are support groups. That's a category, as I show you in our database again. Sometimes even agencies that provide physical and occupational therapy will have um, support groups or trainings that they provide to families. For example, Sprocket Therapy Solutions. If you read the description for their services, they offer that type of information to parents. Also, there's advocacy organizations that could help a family, um, like the ARC Davidson County. They could provide some general information and support resources for this mother as well. So it's really a matter of kind of exploring different ideas, different categories, and finding out what's available. Now I know, based on your roles, that you all are very busy in your professions, and it can sometimes become difficult to add to more work in trying to find these resources. And so in that case, I'd like to remind you that that's what we're here for. We're simply a phone call away. So don't feel as though you have to spend all of your time on our website when we can do the work for you and then provide you that information to share with the patient and the family. So there are other case scenarios that I'll just go through and show you in more areas of our websites. This one says, Matthew is an 11-year-old with cerebral palsy, epilepsy, hip dysplasia, scoliosis, and profound developmental delay. Matthew does not have any type of health insurance coverage because he does not have the appropriate documentation to apply for tent care. He does not walk, and his mother is having difficulty carrying him because of his size. Matthew is at an increased risk of pressure ulcers due to his inability to alter position. The following equipment has been recommended by his therapist to not only aid in his discomfort, but in slowing the progression of the disease. One is a tumble form 2 universal side liar to allow him to rest horizontally with support for his scoliosis and other orthopedic abnormalities, and to reduce the risk of bed sores. The second is a Skill Builder's seating system, which will allow him to sit upright with less discomfort and reduce the risk of gastroesophageal reflux. And vehicle restraint system with mobility frame, which will allow him to ride safely in conventional car, improving with his comfort level and allow the mother to move him from the car to home with easier transport of both the child and parent. So I'm going to assume, and this is an assumption, but based on this case, since he does not have documentation, let's say that he is from a Spanish-speaking background. And we have a sister database called Camino Seguro, and that allows people to identify what agencies have bilingual staff members who speak English and Spanish. So again, we're back to our homepage, and the third option at the dark green navigation bar is Camino Seguro. You can click on that, and it works just like the one I showed you earlier, where you choose the category and then you choose the county. And the great thing about Camino Seguro is, for those like me who are not fluent in Spanish, I can still use it because it's all translated in both English and Spanish. And you'll see right above the drop-down boxes, it says Translate Categories. And so if you click on that, it'll go back between English and Spanish. In this case, I've put it on English to demonstrate. So I chose healthcare services in the first drop-down box. And in the second drop-down box, I chose Knox County. And I clicked the submit button. And again, it shows you a list of agencies. And these are the ones who have staff that speak English and Spanish. It provides the same information as it did previously, with the name of the agency, the website, the phone number, and the location. But it also has that View Details button again. So if you could click on that, it provides you the next web page, which is the same information as I mentioned earlier. All of it's in English and Spanish. But the great thing is that by knowing who speaks the same language at a particular agency, that service is going to be much more easier to access for that family to have someone who speaks Spanish. So this is a good tool for you all to know is available through our website. Now I've gone back to the Pathfinder database for the rest of these questions as well. Because again, just because a person speaks Spanish doesn't mean that they can't access other resources as well. So what resources are available to purchase the durable medical equipment recommended for Matthew? Well, one of the categories that I would recommend searching is equipment exchange program. Since he does not have insurance, this equipment is going to be very costly, obviously. And the great thing about equipment exchange is that agencies throughout the state collect used, working, in great condition, durable medical equipment. And one of the example in Knoxville is East Tennessee Technology Access Program. So they collect wheelchairs and shower chairs, walkers, could even be the tumble forms that are mentioned that Matthew needs. You just don't know because it's based on donations that they receive from others. And then they clean it up, make sure that it's something that even their own family could use, and give it to those who need it for free. So it's always good if there's something that a family needs to check what's available through those programs. There are times when a special education program might provide that equipment as well, if it can be justified as creating access to the education that they deserve and that they're entitled to. It would require advocacy to convince the school system to do that, but we have someone on staff who has experience or had experience in doing that, and there are occasions when it is possible for the school system to provide some equipment. And then that equipment can then sometimes go home with the child as well. And then another category to choose from would be assistive technology equipment. But those are agencies that provide that type of service or program as well. So these are some examples of how we can assist in finding that equipment that he needs. Another question is, are there any other resources that could potentially assist the family in providing the best care for Matthew at home? We don't have a lot of in-home assistance programs that that are available for individuals who do not have insurance or aren't covered by Medicaid waiver or choices programs. But one thing we do always suggest for a family in this type of situation is respite care. That will give them a brief break from caring for their loved one, for them to either run errands or take a mini vacation. It's not for long periods of time, but at least it'll give them an opportunity to do something for themselves and to get a rest from the caregiver services that they typically provide full time. An example of an agency that can assist with that need is the Tennessee Respite Coalition. They provide vouchers to help cover some of the costs associated with respite care, and then they also connect people to respite opportunities or actual providers for that type of service. So, third case is Serena. She is pregnant and offered a job in another town. She locates an apartment and moves to begin her new job. She has her baby prematurely, and Josh suffers from multiple issues. He is in Children's Hospital for an extended time, which causes difficulty in Serena getting to work, which causes her to lose her job. She moved without any basic essentials. She does have a bassinet for Josh, but she is sleeping on an air mattress and has a rocking chair and one small table. When she is able to take Josh home from the hospital, she needs assistance in many areas. Joshua requires tube feeding, has breathing difficulties, which require breathing treatments, and has heart complications. So again, a very complicated situation that this new mother experiences. So what resources are available for nursing care at home for Joshua? Again, this is the area that we don't have a lot of resources available, so we will do some problem solving with the family. Um, so we would help the family or service provider determine what form of insurance does Joshua have. If he's not covered, we would refer them to Health Assist Tennessee so she can have assistance in applying for state coverage for Joshua. We would suggest that they contact the insurance provider to determine what home health service providers are covered by their program or their plan. And we would suggest possibly asking for a case manager with insurance company to help process that request. Because sometimes we get families that call and say that they've been denied for certain services through their healthcare coverage. And sometimes it requires just a little bit of advocacy for them to get that approval that they need. Now, I'm not saying every time, but there are occasions when if someone tries again or has a case manager help, that it will process the request a little bit easier. So, another question is, what resources are there for Serena to obtain basics like furniture and household items? There are financial assistance resources in our database, and one of them is, for example, Salvation Army, that perhaps can help with this particular need. But one of the areas in which we differ, you'll hear from 211, I believe, in another session. And this is a case when we may refer to them because their resources are much more general than ours are. Instead of being so disability focused like we are, they have more community agencies like churches and other organizations that could meet this particular need. So again, it might just be a matter of finding out from 211 what other information is available that we may not necessarily have. And then what resources are there for food for Serena? And again, that's kind of falls under the financial assistance category. Obviously, Department of Human Services offers the food stamp program. Another organization is called Hope for Inner City. And in this case, you can see that I chose Hamilton County, Chattanooga area. So this would be specific resources for someone living in that location. What resources could assist Serena in finding employment that will be flexible with meeting Josh's needs? We have a category for employment resources, perhaps suggesting contacting the Tennessee Career Center to see what's available. We don't have specific job postings on our website, but we try to connect them to organizations that have that information available. We also have a category for vocational training, which can often lead to employment opportunities. An example of that is Goodwill Industries. And then what type of childcare would be available for a child with special needs? I would suggest looking at our child care programs, and a good resource is the Southeast Child Care Resource and Referral. They have specific providers and more information about those that qualify for serving individuals with disabilities. And what resources would there be for respite care since Serena has no family and no support system? And again, as I mentioned earlier, respite care services would be the place to look for that. Um, Aside from the coalition, there are other programs as well that could possibly provide that. Are there any questions so far about these cases or anything that I've mentioned? We're going to have some time at the end of the session, but I just want to take a short break and see if there's anything that jumped out at you before I continue. Okay. There are a few more areas of our website that I want to share with you. May not necessarily relate to a specific case, but it's just good information for you to know that's available. One of the things is our calendar, and this is a statewide calendar of disability-related events that you can access on our homepage. It's the second option to click on. And you can see this web page. You can search by the date. It'll pull up all the events that are happening that particular time. Those that were posted for this week, you can see it provides the date, the time, the title of the event, and location. And these events, everything from support group meetings to trainings, fundraisers, social activities. So if you know of a parent or family that wants to get connected with their community and participate in some activities with their children, this might be a good tool for them to know about. You can also search by location, audience, disability, and type of event if you click on Advanced Search. We also have a resources library, and instead of connecting you to specific agencies in Tennessee, the library allows you to find information on other websites. So it links you to information that's available throughout the internet related to disabilities. And I'll give you some examples. On the left, you can see some of the categories that are listed. A lot of them match our database. So we have advocacy and law, arts and recreation, assistive technology, education, emergency preparedness, employment, healthcare, housing, Junior League Family Resource Center, mental health, religion and spirituality, support families, transportation, and Vanderbilt Kennedy Center. And I've highlighted two of these, support for families and Vanderbilt Kennedy Center resources. These all have subcategories, as you can see. For example, support for families is broken down to support for caregivers, support for parents, and support for siblings. In this case, I'm going to show you the resources that are available to, related to parents. And you can see on the left, although it's small, it provides you different links to websites as well as a description of those websites. And one thing that I like that you're probably already familiar with is Kids Health. The reason I like this is because it provides information for 4 different audiences: parents, kids, teens, and educators. So you can find disability and health information that's relatable to each of those populations. So it's a neat tool to use. If you're working with a child that has a new diagnosis and you want to be able to explain it to them directly, this might be a good tool to find that information. In terms of Vanderbilt Kennedy Center, since we are a program of that, we like to connect to their resources as well. And they have great tip sheets, is what they call them. They are two-sided flyers on various disability topics. On the left, you'll see the disability-specific topics like ADHD, Angelman syndrome, autism spectrum, Charge syndrome, Down syndrome, Fragile X, Prader-Willi, Williams syndrome, on and on. And then on the right are some examples of self-advocate family support tip sheets. And again, the categories, the topics are quite extensive. And the great thing about these tip sheets is that they're simple and easy to access. On the first side, it's general information about the topic, and the second side are resources related to that topic. So these are easily to print and to share with patients or other colleagues. There's even one going to the doctor, which helps prepare a child who has a disability what to expect when going to the doctor. So, and then the last resource that's part of the Kennedy Center is fresh off the press within the past few weeks. It's called the IDD Toolkit, and it is healthcare tools for individuals who have intellectual and developmental disabilities. And it's got great resources that include behavioral checklists or plans for crisis prevention and management, all sorts of different things. Something that help explain how to prepare for a patient who has certain types of developmental disabilities like autism, Down syndrome, kind of what to expect and how to best meet their needs. So this is a great website for you all to know that's available. It's called Healthcare Intellectual Developmental Disabilities Toolkit. There's a few more printed materials available on our website. If you go to our homepage, you'll see the icon, Share the Word, download flyers and materials. In addition to our flyers and our bookmarks that you're welcome to print, there's some pamphlets related to autism. Some are in English and some are in Spanish. And they're guides for parents. So we encourage you to check those out as well and to download them and share with anyone who's interested. If for some reason you need more materials that you can't print yourselves, we are always happy to send you some to get in the hands of those who need it, whether it be patients, their families, or other colleagues. All you have to do is call us or send us an email, and we'd be happy to mail you some if you need it.